Okay, we're going to see what we can do here, y'all. This is Saturday, the 21st of March. And if my cousin's watching, happy birthday, Carol. Yesterday, my uncle Pete celebrated his 80th birthday. And tomorrow, my cousin Chris will celebrate his 56th birthday. I ain't telling how old Carol is. She's a little bit older than me. And then on the 23rd, which is Monday, uh, my cousin Beth's son, Braden, has a birthday. And Melissa Spooksy, her son, has a birthday. So hopefully got all those covered. I don't know if there's any more or not, y'all. I'm right out of it. But this is for an update. And let's see, I think I last talked to y'all on the 17th, which was Tuesday. I told you about my appointment with Dr. Duhane. Well, since then, let's see, I have gone to Dr. Riles, my ENT, that was on Wednesday. He said everything looked good. He looked at the PET scan, agreed with Dr. Duhane and the radiologist that read the scan, and agreed that he concurred that it was not a stage 4 cancer, and that you know what they said in the reports looked right to him, looked good to him. And then he checked everything, and he told me that he wants to change out my trach. Some of y'all will know what I'm talking about on this, some won't. Only reason I know is because I'm learning this stuff. I have what's called a cuffed trach. See this little doohickey here? This little thing can be inflated. If the little flat part right here is puffed up, it means it's inflated. And what is inflated is the balloon around the trach. And what it does is it blocks off my airway above the trach. And that's so that a ventilator can be used. And so he said he didn't think I needed the cuffed trach anymore. So he's got me a prescription for a uncuffed trach. And once I get it, I had to go through Dr. DeHame's office to get that because I've got like 4 of these here, and I just have to see if they'll let me exchange one for an uncuffed trach. And then I've got to see if I can get Respire, uh, respiratory company, to pick up the one that they sent me. I didn't order it; they sent it along with the latex gloves they sent me, which I'm allergic to. But once I have the uncuffed trach, he told me to contact his office, come in, he'll change it out, no problem. Okay. And then I have an appointment with him in 6 weeks, which will be April 30th. Um, but he did say that if I needed to change it, I could. That's not a problem. Okay. Got that part taken care of. Now, I have 6 appointments this coming week. I have 2 on Monday, 2 on Tuesday, and 2 on Wednesday. Dr. Duhame is serious about getting me started on chemo and radiation, but she has to get other things in line first. So I've got my little handy dandy Maxine calendar here that's got my appointments in it. And we're going to see if I can read what I wrote, y'all. Okay, I've got one appointment at 11:30 uh, on Monday, the 23rd, with Hamilton Diagnostics. No, not Hamilton Diagnostics, Hamilton Gastroenterology. They're going to check my feeding tube, make sure everything's okay with that. And then that afternoon at 2:30, I have an appointment with Dr. Billy Chung. He is an oral surgeon. So he's going to be doing a consult, checking my teeth, checking my jaws, seeing if I need to have any teeth pulled and all that. Okay. Tuesday, I have a Lord only knows what that one says. Y'all, I'm having to look because I know I have an appointment with the radiologist, and then I think that's I think that's on Tuesday. It's the radiologist. Nope, that's on Wednesday. Sorry, I'd have to check my phone because I've got. I think I missed writing one down, but it might be the general surgeon. I have to see the general surgeon about having another port put in, which thank God for that. I don't have to get stuck every single day with an IV to have my chemo done. Ports I can live with. I've had one for over 4 years, so I can live with that. Um, then I also have a 1 o'clock appointment with Courtney at Dr. DeHaim's office on, I think it's said chemo education. And I think she'll be going over what type of chemo is going to be used and how they're going to do it and all that for me. Because it's going to be different than what I went through before. Because before I had one chemo treatment, 3 weeks later I had another chemo treatment, and so on. This time it's going to be Monday through Friday for up to 6 weeks. And I'll have Saturday and Sunday off, so I'll be getting chemo 5 days a week, radiation 5 days a week. Okay, so she's going to go over the chemo part of that with me. Then I see, like I said, the radiological oncologist, who is in the same building as Dr. DeHaim, just on a lower floor. And I see them at 1 o'clock. And I know I have another appointment. I just cannot for the life of me remember what it is. I see general surgeon, oral surgeon, radiologist. Got those. Gastroenterology. Got that. Um, hearing test. Hearing test. And that might be what's Tuesday. I don't remember. But anyway, I go to Hamilton Hearing to have my hearing tested and checked. So those are the 6 things I've got coming up this week. I've just got to, I have to remember. I've got it on my other phone. I've got it on this phone too, on my calendar. But I try to keep track of it everywhere. Yeah, I really do. So I've got that. Once I have consulted with all of them, once I've had my consult with Dr. Chung, he will send back what he finds to Dr. DeHaim. They will work with the foundation they work with and see about taking care of what needs to be taken care of. Once I go through the hearing thing, that again has to go back to Dr. DeHaim. I don't know what else is going on with that. Just check my hearing to see, I guess, what my hearing levels are right now, which I do have some old age hearing loss. I know that. I'm not deaf. I can hear. It's not the best in the world, but I can hear. And then, let's see, follow up on the gastroenterology, have them check my feeding tube, make sure I'm cleaning it, keeping it taken care of. Oh, and when I talked to Dr. DeHaim, uh, there was Dr. DeHaim, there was Courtney, there was Brianna, there was Ashley. I'm trying to think there was somebody else in there, but there was a whole bunch of them in there. And we were all talking different things at the same time. One was taking care of financials and setting up appointments. Dr. DeHaim was getting consults set up. Uh, One was talking about getting everything scheduled for the the feed for my feeding tube, the formulas. It's not really formula. It's like a protein drink, is what it is, but it's nasty. It'd be nasty to taste, but for the feeding tube, it works. Uh, and the other one, like I said, she was helping on other things as well. So there was a lot really going on, and I was just taking notes and asking questions best I could. But I did have a question about the feeding tube and if there was a binder or something that I could put the tube in to keep it from dropping. Because, yeah, I'm not trying to be graphic. I'm just going to show y'all if y'all can see this. This is my feeding tube. Okay, this little doohickey here and this little doohickey here is where the liquid goes in. The feed goes in this one. Medication goes in this one off to the side if I have to have it through that. And you'll see I have it taped over my stomach, right? Well, if that tape comes up, this thing unfurls and it's a good foot long. And it will dangle down between my legs. And that's very unsanitary. And so I've asked them, do they make things to where I can keep it, up without having to put tape on it because that tape irritates my skin after a while. And one of them was telling me about a binder or a pouch with a binder that I could put around my waist and put that in. And she said that she would order me one and that it should be in sometime, within a few days or whatever. And I told her I just pick it at my next appointment. That would be okay. She said, that's fine. So, got that taken care of. Let's say yesterday was Friday. Thursday was Dr. Riles. Friday, we didn't do anything yesterday regarding medical so much. We did run to Ringgold to the tag office to get my handicap placard. Excuse me, yesterday was not a good day for me. All the pollen off these trees, it seemed like everything just settled. And I was coughing up and down all day yesterday. Coughing. And I couldn't really get a whole lot up. Now, I do have my pump back there, but it's not suctioning anything out of my trach because I don't have a lot of secretion and stuff down there. And I even told Dr. Riles that. He said, well, you didn't have that in the hospital. Okay. So, I get what comes up in my mouth, and if I have an excess of saliva, I get that out because it just gets hard to swallow all of that. But I did tell him that I was cleaning my trach twice a day, once in the morning and once in the evening. And if y'all don't wonder what I'm doing, I've got dry stuff that comes up, and I try to keep it off my skin as much as possible because it causes irritations. And I'll flick it off and throw it in trash. But so I'm doing my best to keep it clean. When we take this trach cannula out, and what you do is you take this valve cover off, this little thing right here with the screen. This comes off. There's a blue covered tip in there that's called the cannula. This white thing here is called the collar. And this here's the strap that goes around. And the inside part is the actual trach tube, or the outside part here, right here. Because once you take the cannula out, there's still a hard white tube there. And I'm going to tell you, what comes up out of that thing can be really nasty. It grosses me out. I thought about maybe doing a cleaning one day on video. No, I ain't doing that. If it grosses me out, if it grosses Piggy out, I am not putting it out there to gross anybody else out. Because we joke about hawking loogies. And if you live in the country, I guarantee a country boy will hawk a loogie in a heartbeat. Some girls will. But when you start hawking loogies out your throat, you know, nasty. And I do that in the mornings a little bit. I've got some tissue up above my bed. I get ready to start coughing. I get me some tissue and I start coughing. I don't want them flying all over the house because it's got some force behind it. I can get enough force when I'm coughing to pop that cover off and shoot it across the room. That's how forceful it can be. Uh, but I clean all that out. Like I said, Piggy check it for me to make sure it's clean. He gets what I don't get, and we make sure I get down inside the outer trachea too and get that because I've got some nasty gunk out of that. But yesterday I had a really bad day with the pollen, building a lot of stuff up. Got to where I couldn't really breathe very well. So when I went to bed before I went to bed last night, I cleaned my tray, and I went to bed kind of early for me. I guess I went to bed about 8, maybe a few minutes after, and actually slept good through the night. Got up this morning uh, about 7:50. I slept. I mean, I'd woken up through the night, but I laid there and went back to sleep. Got up, cleaned my trach, checked my blood sugar, uh, did my insulin. We did the bolus, and then I had Piggy fix me a sausage biscuit because I was actually hungry, y'all. Had a sausage biscuit, some cranberry grape juice, I should say, and I drank part of a Diet Coke, part of a Diet. Uh, well, it's generic Coke, so it's Diet generic Coke and Diet. Uh, lemon up, lemon. It's almost like a Sprite, but it's the generic version. But this is what I had this morning. This is the Food Line brand. Right now, I've got a Diet ginger ale sitting over there. I'm hoping tonight, tomorrow go great for me. Got to get up early on Monday, get started, get to these appointments, get them taken care of. Start all over again on Tuesday. Start all over again on Wednesday. I will do my best to give y'all an update Tuesday afternoon or Wednesday afternoon when I get home. One of the two. If I do it Tuesday, I'll give y'all another one. Probably Thursday or Saturday. I'm not sure which. It just depends on everything I have going on. Because I have a lot going on. I mean, a lot. Y'all, I'm heading on 20 minutes. I thank y'all for listening to me ramble. If y'all don't want to listen to this, I'm sorry. I'm just trying to share my experience with what I'm going through with the cancer, with everything leading up to the treatment for the cancer. And hopefully this will help somebody else. And just remember, every day, if you know Jesus as your Lord and Savior, you're in a win-win situation, folks. Because if something happens, you go home, you know Jesus, you've won. If you get to stay another day with your loved ones, you've won. So you're in a win-win. Get down, Miss Fancy. I can't let you up on me, darling. Sharp claws, feed tube. Yeah, she can't be up on me. But, and also remember this. Attitude is everything. Try to keep a positive attitude in life. Because negativity breeds negativity. And when you try to be positive, it breeds positivity. So that's what I'm trying to do, y'all. Trying to make it all about the attitude, keeping it positive. And I know I'm in a win-win situation no matter what happens. So thank you for watching. Hope you have a great day. Bye, y'all.